How's it going, guys? For those of you who don't know me, my name is Ian Killen, and I'm the owner of Hometown Physical Therapy and Performance. And what we're doing through the month of October is answering your questions. So the one that got sent to me most recently was, why is my herniated disc causing me back pain? My simple answer to that would be, maybe it's not. And so what I wanted to do today was to go through the anatomy of a herniated disc and what it might cause and why it gets blamed for a lot more back pain than it should. So the first thing, we're looking at a back here. Definitely a lot of muscles that attach back there, and we'll get back to that later. But what I wanted to do is show the spine and what a disc is. So what you're looking at here is the lower back. There are 5 bones that make up the lower back. They're called lumbar vertebrae. And between each vertebrae, you can see this white stuff, which is a intervertebral disc. So what the disc does functionally is it provides a little bit of space and a little bit of shock absorption between the 2 bones, the one above and the one below. And the advantage to that is that it creates enough space for this nerve out here to run through. And so in younger people, there's a lot more fluid in that disc than there are older people. So the average age at which you typically will herniate a disc are late 20s to early 50s. Anywhere past that, typically you don't re-injure a disc or create a new injury. And if you look at what a disc is, we'll zoom in here. It's essentially this very dense white stuff. Almost think of like a celery stalk. It's very full of water, but it's also very dense. So it's not something that necessarily slips inside and out. When you herniate a disc, you actually move some of this gel in the middle, that's pictured blue here, towards the back. And so if we use our pen here, it's not that the disc actually moves in and out and slips around, it's that this gel gets forced back into the wall of the disc. And so when it gets pushed back, that space that we looked at before becomes narrower. So if we tab back to the previous section, if you imagine, and we'll rotate this a little and zoom in, if you imagine a bulge going back, that's going to create more pressure in this area right here. And if you create more pressure there, that nerve that's coming out is going to get compressed. So the reason that a lot of times herniated disc gets blamed is because they are there, but they are not creating the back pain. What they're doing, this nerve, if you look at it, it travels down into the leg. So if somebody says they have sciatic pain or weakness or numbness or tingling into the leg, then I'd agree that something, maybe the disc, maybe a bone spur, maybe arthritis, there's a lot of things, but something is compressing on that nerve. So then why do we have back pain if we have a herniated disc? So the herniated disc sets off a alert to the body. And so what can happen is a lot of the muscles that connect in the back will respond, on top of your brain sensing that there is something wrong and increasing your pain receptors. So if you look at the back, there are a lot of muscles that all hinge in this area right in the back here that we call the SI joint. And so all of this dense connective tissue, I'm going to undo that and use the pen. All of this dense connective tissue, it all attaches to a bone called the sacrum. And so the sacrum oftentimes takes a lot of that pressure on and a lot of those muscles compressing. So what that's doing is it's increasing your back pain on top of some of the alert system that's going out through the herniated disc. So what we would do in PT is run you through a thorough evaluation, because there are a lot of things that can cause back pain, and not all of them are musculoskeletal. Not all of them are muscles, joints, or ligaments. Sometimes there's something bigger at play. If there is, then physical therapy isn't appropriate, and we refer you to the right people to go see. But what we do typically is look at that back, look at what's tight, what's limited. So there's a lot of muscles that attach back here. Your hamstrings, your lats, your gluteal muscles that are all important in walking. And so we run you through a full movement exam and figure out what might be causing your back pain, rather than just saying, oh, it's a herniated disc and there's nothing we can do about it. So if you have any questions about this, this is definitely a topic that we can dive deeper into. There are a lot of reasons for back pain, but I wanted to go through the herniated disc a little bit today and hopefully make a little bit of sense of it. But if you do have further questions, please message me. I'm happy to take any questions, and I'm looking forward to doing some more videos in the month of October. Thank you, and have a great weekend.